Okay, welcome everyone. We are going to get started. Welcome to session 8 of the WASH in Healthcare Facilities Initiative webinar series. My name is Joanne McGriff, and I'm the Associate Director of the Center for Global Safe Water, Sanitation, and Hygiene at Emory University, also known as the CGSW. And I'm also the Assistant Research Professor in the Department of Global Health at the Rollins School of Public Health, also at Emory. Today, we are happy to have with us colleagues from UNICEF Tanzania and UNICEF New York, who will be talking about national action in WASH in healthcare facilities. I am joined by members of our learning team from the Emory CGSW, Dr. Christine Moe, who is our director, Ms. Lindsay Denny, and Cassandra Savino. As you all may know, this series is part of an action-oriented learning platform that seeks to connect, share, and act. We connect the expertise and experience of our partners and colleagues to the WASH and health community members who are interested in moving to action in WASH and healthcare facilities. We also provide a platform for the community of practice to share experiences, ideas, and best practices. And then finally, we encourage individuals and groups to take specific action to implement sustainable interventions that improve WASH conditions in healthcare facilities. So as usual, I see some people have already started. I invite meeting attendees to start introducing yourself by locating your chat box, going to the drop-down menu and making sure that you select all attendees, not just the panelists, and then type in your name and organization in the chat box or any comments that you'd like to make as I review some additional notes about the structure of the platform. So this is a reminder for many of you. Each month, we highlight a WASH in healthcare facilities subject matter experts in a 25-minute presentation, followed by 30 minutes of facilitated discussion. Today, we will have 2 speakers who will present for a total of 20 minutes, followed by a commentator for 3 to 4 minutes, after which we'll move to the discussion. For reference, please be reminded that you and your colleagues have access to webinar recordings, slides, learning materials, summaries, and action documents through our website, win-hcfaction.org. And if you have questions or feedback, you can send us an email at win-hcfaction@emory.edu. We are also on Twitter, so please consider following us on our Twitter handle at win-hcfaction. And so now I'll pass it on to Lindsay Denny, who will provide a few additional reminders and recent WASH healthcare facility updates. After the announcements, I'll introduce our speakers for today and move right into the learning session. So Lindsay?
Good morning, all, and thank you all for joining us. Before we get started, I want to go through the guiding principles that lead to how we select topics and experts for our webinar series. So first, we believe that WASH is a fundamental prerequisite for quality of care within a healthcare facility. Secondly, we believe there cannot be effective infection prevention and control without adequate WASH in healthcare facilities. Third, sustainability should be built into every WASH in healthcare facilities project or program from the very beginning, no matter the project size, and that includes WASH projects that are integrated into other health systems programs. And finally, WASH in healthcare facilities is not just about addressing issues at individual facilities. Multiple systems, sectors, and stakeholders must work together to see sustainable improvements. For those of you who are just joining us for the first time, a bit of background on why we put together this webinar series. First, WASH in healthcare facilities is critical to the achievement of SDG goal number 3, health and well-being, and goal number 6, water and sanitation. And secondly, last year, the UN Secretary General made a call to action on WASH in healthcare facilities, launched at the Water Action Decade. And since then, UNICEF and WHO have driven their WASH in healthcare facilities campaign even further. And I'll talk about that in just a moment. In the past, we've done 7 webinars, one on system strengthening, assessments, hand washing in healthcare facilities, the Clean Clinics approach from Save the Children and USAID's Maternal and Child Survival Program, research on WASH and neonatal sepsis, costing, and then Soapbox last month presented their toolkit for cleaners. So before we get started, thinking about the news and updates, for those of you who have been paying attention, you may have heard about the new JMP report, which was published the first baseline report on Washington healthcare facilities. In addition, on the same day, this month, WHO and UNICEF also released a document on their 8 practical steps to achieving WASH in healthcare facilities. And finally, they relaunched the WashingtonHCF.org website. So take a look at that if you haven't had a chance. Great new content up and abilities to upload your own resources. Really fantastic website. They did a great job. In addition, WHO and at the World Health Assembly for WHO next month, if you or your organization is interested in supporting the resolution, you can sign on to the civil society letter. I will put the link in the chat box, and also we will send it out with the resources for next month. The deadline to sign on is May 3rd. For those of you new to Zoom, just a quick note that you can use the chat box at any time to introduce yourself, ask questions, or make comments during the presentation. I will not be highlighting the questions until the facilitated discussion section, but please feel free to ask them at any point. And then also, you are free during the discussion section to raise your hand and make a comment if you have a microphone on your computer. Once you've asked your question, or if you don't want to ask it any longer, please lower your hand. So Joanne, I will pass it back to you.
Great, thank you, Lindsay. And again, I encourage you all to put your name and your organization in the chat box if you haven't already. And remember to select all panelists and attendees so that everybody can see you and not just the panelists. And so now we come to, again, session 8, which is entitled National Action on WASH in Healthcare Facilities, Experiences from UNICEF Tanzania. Today we are pleased to have with us our presenters, Frank Odhiambo, who is the Chief of WASH at UNICEF Tanzania. We have John Mfungo, who is a WASH specialist at the UNICEF Tanzania office also. And then following the presentation, we will have reflections and comments from Ms. Irene Amongin, WASH in Schools and Institution Specialist from the UNICEF New York office. Again, we're very excited to have our speakers with us today. And without further delay, I welcome John Mfungo, who will begin the presentation. John, please go ahead.
Okay, thank you very much, John, and thanks for the introduction. We are also happy, and we would like to thank Emory University for giving us this opportunity to share our little experience for WASH in healthcare facilities in the context of Tanzania, so that we contribute to this initiative. So our presentation will cover several aspects. Lindsay, are you there?
Your screen, it looks great. Go right ahead.
It's yes, not moving.
Perfect. You are set. Go right ahead.
It seems to be stuck somewhere.
If you just click through the next slide, you should be all right. I can see your screen.
Would you like us to put up your slides and maybe we can click through it?
All right, yeah, now it's fine. Okay, so we'll provide some overview of the Tanzania and then the situation of WASH in healthcare facilities, and importantly on the experience that we have, especially the action that the country has taken as we try to improve WASH in healthcare facilities for better care of mothers and newborn. And then we'll also share some of the challenges and then the way forward. So Tanzania is a country in East Africa. So you can see in the map, on the map, it's an Eastern African country with a population of 55 million people. Interestingly of this population is that almost 50% is young population, and with a population of 17% for the under 5 children. Tanzania also has a high population growth rate in the world. The annual growth rate is around 2.7%. And the country has over 8,000 healthcare facilities, of which more than 5,000 government facilities. So we would like to share some few data on Tanzania about the WASH in healthcare facilities. While we acknowledge that this is a new area of intervention, because it was for years it has been neglected. So this is a new initiative to try and address the WASH in healthcare facilities. We would like to share some few data, and we also, just to highlight that this data is from the national survey system, but it has some limitation that hygiene is really not covered well. So, but at least you can see that more than 32, about 32% of the healthcare facilities have no water sources in the facility. So you can imagine going to a facility, and then especially for a pregnant woman going to the river and then there is no water, I think you can feel the pain. And then in terms of sanitation, 44% of the healthcare facility have a functioning toilet, and you seeing the numbers, you can realize the gap and a kind of effort needed to improve the situation. In Tanzania, the healthcare facility system is divided into around 3 levels. So you have the national and the specialized hospital, then there is regional, and that is subnational hospital, and then we have the lower level, which is the dispensary, where most of women deliver. So the situation in this lower level facility is really not encouraging compared to the national one. Based on this situation, we are prompted as UNICEF to conduct some assessment in 7 districts where we do some intervention, and the finding also showed the same pathetic situation where about 42% of the healthcare facilities surveyed were found to have no functional hand washing facilities in delivery rooms, and more than 58% of the healthcare facilities had no piped water supply into the facility buildings. So it might be that water facilities may be around in the premise, but not in the building. So these are just bar chart, but it's the same statistics, but this one is trying to compare the trend. So from 2006 to 2015, there has been some improvements, where if you can see on the left side, these are are grouped into this the system which I said. Also, you have hospital, you have a care center, then the dispensary. So you can see that in 2006, the situation was not good as it is in 2015, but though you can still see the gap that for 76% of the hospital have client latrine, but when you move to the lower level, you see the difference, 76, then this is 40%. So this gives a sign that there is a lot to be done. In terms of water, again, the hospitals are not doing bad, still a gap of around 13%, but when you go to the lower level again, you see in 2015, it's only 65%. This slide here is one of the findings from the study I mentioned in the 7th district, and it shows, I think we all know the importance of the frontline workers in terms of infection prevention control. So in this district, it was found that most of the frontline workers are not trained, as low as 12%. I mean, trained in Temeke or in Njombe 8%. So this is an area where also we still, as a country, we still need to do a lot of improvements. This I would like just to share the general knowledge, not specifically for Tanzania, but at least that we know the importance of wash services in healthcare facilities, that with poor wash services in healthcare facilities, the patients or the mothers going to hospital, it is very difficult to control infection. So it's very easy to have infection if wash services are not improved at the healthcare facility. Again, this also leads to high healthcare associated infections. We don't have actual data, but in 2011, WHO did some assessment in a number of countries, and in Tanzania, it was found that the prevalence of healthcare acquired infection is around 15%, so which is very high. But also with better, without better washing healthcare facilities, it is very difficult to have quality healthcare services, both to patients, healthcare workers, as well as people who are taking care of the patients. And of course, the situation limits or discourages people to visit healthcare facilities, because you can imagine that you go to a healthcare facility, then you acquire infection, or a woman going for delivery is asked to go with a bucket of water. So it really affects the care-seeking behavior among patients. As we know, healthcare, washing healthcare facilities has impact on maternal and the newborn for children. And this slide is just to highlight the situation in Tanzania, that there has been increasing in the facility-based delivery from 63% in 2015 to 55%. But there is a danger of this number going down again if we don't do much in improving washing healthcare facilities. Also, the country has high rates of maternal mortality, which stands at 556 deaths per 100,000 live birth, and the neonatal mortality is around that. Connected to this, we would like to share what are the reasons which are leading to this situation in Tanzania. So this graph here shows some of the causes, and I would like to highlight more on the sepsis. So you can see the prevalence is very high at 10%, which means wash in healthcare facility will significantly contribute to get this situation improved. The second pie chart here shows causes for under 5 mortality, and this is in 2015 as per the countdown 2015-2030 data. You see diarrhea is one of the big contributor to this, and also again sepsis and infection. So these are the areas where the sign that without doing much in wash, we can still face these big problems. As I would also like to share the institutional framework for wash in Tanzania. This has a significant meaning, because if the institutional setup is not clear or is complicated, it can also lead to some bottlenecks as we try to implement these initiatives. So Tanzania, the institutional framework in terms of healthcare facilities, as I mentioned earlier, we have the national level, we have the subnational, and of course the governance. So at subnational level, as I said, you have the Minister of Health, Minister of Water, and then we have President's office. All of these have different roles and responsibility towards washing healthcare facilities. And as a result, there might lead to a situation where no washing healthcare facility will be defined as no one is home. The Minister of Health will think This is for means of water, and they will feel that this is the responsibility of the PORAG, the president's office. At subnational as well, it's like it is mirroring the national level, but now at the regional level and district is more of the departments of the same ministry up there. And another important feature for the institutional framework is the governance structure, where we have the regional and country health management teams, country health service boards, and health facility management team. That is at the level of the facility. So all these have roles and responsibility to play towards the WASH in healthcare facilities. At this point, I would like to share the factors that contribute to inadequate services in WASH in healthcare facilities in Tanzania. So some of the issues is part of the initiative, which I will talk later in the coming slides, but at least to highlight the inadequacy of financial allocation and of course human resources. In Tanzania, we find that one qualified doctor is saving more than 10,000 people, so you can feel the burden. And then another area is the monitoring system is very weak, and we face unreliability of data, which poses difficulties in terms of follow-up and monitoring. And then unclear responsibilities, which I have mentioned when I was presenting the institutional framework. And then the poor operation and maintenance aspect, as you can see from the photo on the right. This is this is one of the health center where the hand washing is not even working, so you can imagine. So having shared all this situation, then this has become like a trigger for the country to take some important steps to try and address the situation. As we know, WASH in healthcare facilities is an enabler for provision of quality healthcare services to patient healthcare workers and the carers. So having known this, the country has tried as much as possible to try and address the gaps which are prevailing in WASH in healthcare facilities. And of course, always we seek for improvement. So the country also is trying to see how the situation can be improved. So this also is a driver for the country to take some steps just to improve the situation. Another point which I would like to highlight is that Tanzania has always embarked on quality improvement issues, and part of this improvement is to improve WASH in healthcare facilities. And of course, we know the SDG has set some targets to be achieved. Then we have the national development plans, which also highlight for all the stress for the emphasis on the improvement of healthcare services. Without WASH, it is very difficult for healthcare services to be improved, particularly under the IPC context. So I would like also to share this key initiative that the government has undertaken. One of the big initiatives has been to develop the national guideline for WASH in healthcare facilities. You see on the left that is the document, and there is a link there if participant would like to access this resource. That link you can open and then you can see all the things. But this guideline have been a good impetus to move WASH in healthcare facilities as the next level, where the guidelines first of all they have attracted political will, because they were launched by the Vice President, and then the Ministry for Health is very supportive to this guideline. And what we remain now is to ensure that the country is rolling out this guideline. The guideline highlights standards of what's to be implemented in terms of the WASH component, governance, planning, financing, all these components, which are very important. And then during the development of this guideline, the country ensured that there is high engagement of key stakeholders in the sector, both from WASH and from health. So we believe the rolling out of this guideline will bring big changes for the healthcare services in Tanzania. Tanzania also is a participant in various global initiatives. Just right, that is one of the 9 countries, others including Bangladesh, Uganda, and other countries, who are participating in the WHO and the UNICEF supported network for improving quality of care for maternal, newborn, and child health. The network aims to strengthen the national effort to end preventable death by end of the SDG targets and improving the quality of care. So as part of this effort, I think you would agree with me that one way of doing this or achieving this goal is to improve quality of WASH services in healthcare facilities. Last year in December, with the collaboration of Emory University, Tanzania held a workshop for WASH and the health policymakers on WASH in healthcare facilities. This was a 2-day workshop, which was hosted by the Ministry of Health, UNICEF, and Emory University, and was held here in Dar es Salaam in November. The workshop provided an opportunity for policymakers to reflect on the current status of WASH in healthcare facility, as well as the challenge faced. So it was an important gathering which brought together different practitioners in the area of health and the WASH to try and reflect on strategies, opportunities, and of course barriers, and how this can be addressed as part of improving WASH in healthcare facilities. Also, as part of this initiative, Tanzania has started piloting the WASH FIT, the WASH Facility Improvement Tool. And as we know, this is a multi-step process to facilitate improvement of washing services, quality and experience of care. Some of the facilities here in the country have started improvement based on this orientation, and we hope more will also adapt this as we continue with advocacy. And of course, we have the National Communication Strategy on IPC, which also highlight the importance of WASH, especially hygiene, hand hygiene, just to try and address some barriers in terms of behavioral change for healthcare workers, because sometimes being at a healthcare facility, someone will just feel that they're safe, but at least this need to be reminded, and they need to practice as well. All these initiatives have been implemented, but there are still some challenges, which include low prioritization of WASH in healthcare facilities. I think most of the time you find that the prioritization, the other health care intervention are more prioritized than we take for granted that WASH is fine. But then I think it's also time to make it sure that as far as we accord high priority to the other component of healthcare, WASH also is very important. And actually here the problem is more complicated, even because of the institutional setup. As I said, WASH in healthcare facilities cuts across more than 3 ministries. So you can see the issue of roles and responsibility among these ministries, though we are trying as a country to do some coordination, but it takes time to get these things sorted out clearly. There are issues around budgeting and, of course, a weak implementation capacity. along with lack of sufficient number of staff, especially in the healthcare facility level. Another issue is around reliability of data. This is an area which also the country is still lagging behind, but with support from UNICEF, last year also we had a workshop with the JMP, and one of the deliberation was to form a technical working group for WASH data, which has started, and we believe that in future this situation will be improved. Of course, a clear coordination mechanism which goes around the point of institutional setup. So, way forward now is we are having learned from this experience and trying to move forward. The country is planning to build national capacity for implementation of WASH in healthcare facilities in collaboration with the other development partners, donors, and the civil society. One of the initiatives is to roll out the guideline, and the country is planning to train core national facilitators and the lower level teams in the implementation of WASH services in healthcare facilities, which also includes IPC. Also to demonstrate the application of the guideline, because the guideline, they have set some standard, and they were just launched in 2017, end of 2017, start of 2018. So it hasn't been really implemented at a wider scale. So this is one of the focus that it should be ensure that it is implemented at a wider scale for improving the quality of care. As part of this, the government is now in the process of producing tools and a simplified version of the guidelines so that to facilitate implementation. And the Ministry of Health is working with the district and the regional level to appoint a focal person just as possible for WASH, because without this person, we still face the same situation where prioritization of WASH is really not taken care of. And of course, the issue of evidence generation, just to generate evidence to be able to advocate on the importance of WASH in healthcare facilities, which will inform the prioritization and the leveraging of funding to scale up the intervention. So this is the end of our presentation. Maybe Frankie has some addition, but at some point maybe he will chip in. And so we thank you all for listening to this experience sharing session. Thank you very much. John.
Great. Thank you, John Mfungo, WASH specialist from the UNICEF Tanzania office, for this wonderful comprehensive overview of Tanzania's action initiatives and way forward. Unless we have additional comments from the Tanzania team, Frank, would you like to make any comments?
Not just yet. I'll probably come in during questions. Thanks.
Great. Thank you so much. Again, we have with us Frank Odhiambo, who is the Chief of WASH at Tanzania office, who is present to help us move through the discussion. So now I'd like to invite our commentator, Ms. Irene Amongin, WASH in Schools and Institutions Specialist from UNICEF New York. Irene, if you would give us some reflections and thoughts about the presentation.
Thank you very much, Joanne. Just to confirm that you can hear me well.
Yes, you're sounding crystal clear.
Okay, thank you. Yeah, so good morning, everyone. Good afternoon and good evening. Thank you very much for this opportunity. And I don't think I need to introduce myself, as Joanne has already mentioned who I am. So I'll just go straight into the reflections based on the presentation that John has given us. So I think we all heard from John that the situation of WASH services in healthcare facilities was lower. First of all, John, thank you very much for the presentation. Sorry. So one of the things that we heard from the presentation was that wash surfaces in healthcare facilities was lower in dispensaries and other lower level facilities like, health centers, depending on the country, clinics, as compared to hospitals. And I just wanted to mirror this to the WHO UNICEF Joint Monitoring Program report that was released over a week ago, which actually revealed that 11% of other healthcare facilities, which covers clinics, dispensaries, and health centers globally, had no water services, and this impacts over 2 billion people who access such healthcare facilities. And the same goes for sanitation as well. So I will not go into the details of the JMP report. I see that Lindsay and colleagues have already shared the website, and I believe that many of you have by now read it. So please take a look at it. So you can see that, the problem of lack of or inadequate wash surfaces in healthcare facilities is not unique to Tanzania alone, but it's rather a global challenge or problem, if you call it. And the other thing that we heard from John was the impacts of, inadequate wash facilities in healthcare wash surfaces in healthcare facilities, which includes weak infection prevention and control, as well as the increased risk of healthcare-associated infections, which is one of the leading causes of neonatal deaths among newborns in healthcare facilities, as well as the inability of healthcare personnel to provide quality healthcare. So again, this is not something that is only happening in Tanzania, but rather a global problem, particularly in less developed countries, but also some middle-income countries. And available data suggests that the highest newborn mortalities actually do occur in less developed countries, but also not surprisingly in middle-income countries. So according to UNICEF, 7,000 newborns died every day in 2017, mostly from preventable and treatable conditions, including infections like sepsis, which is partly caused due to unsafe water, sanitation, and hygiene. Lindsay also talked about the JMP report and the accompanying report titled Water, Sanitation, and Hygiene in Healthcare Facilities, Practical Steps to Achieve Universal Access for Quality of Care. This report also notes that more than 1 million deaths among newborns each year are associated to unclean baths, and that infections account for 26% of neonatal deaths and 11% of maternal mortalities. So indeed, the risks of poor wash or unsafe wash are increased for mothers and newborns, but also for the general population. Everyone who accesses healthcare facilities are at risk of acquiring infections if water, sanitation, and hygiene are not in place or are not of good quality. There's also a report by WHO. I see Maggie's online. Maybe she can share the link. There's a report also by WHO that estimates that 700,000 people die annually due to factors related to antimicrobial resistance, and that 10 million lives are at risk of drug-resistant infections by 2050. It looks like a long time from now, but it's actually not. So you see the complexity and magnitude of the problem, which is exacerbated by poor water, sanitation, and hygiene. So we also heard from John that wash is crucial for preventing infections and reducing the spread of antimicrobial resistance and providing quality of care. And we all know this. It's not anything new to us. And we know that there are barriers that are preventing healthcare facilities from having access to wash services in healthcare facilities, some of which John mentioned, like funding, poor monitoring, the lack of standards for washing healthcare facilities, the lack of policies, or the lack of implementation or monitoring of these policies, and lack of accountability, as well as lack of maintenance of these wash services in healthcare facilities. So I just wanted to quickly say a few things that UNICEF is doing in this area. So what are we doing as UNICEF to overcome these barriers? So through the UNICEF Every Child Alive campaign, I will share the link in a moment with you. Through the Every Child Alive campaign, UNICEF is calling for governments and authorities to make sure that every mother and a newborn baby have access to affordable and quality care. And in 2018 alone, UNICEF supported national governments in several countries to improve wash facilities in 3,355 healthcare facilities. Linda, I don't know if I still have a few moments to go on.
Just a minute or two, Irene, so we can get to the discussion, but please.
Okay. Yeah, so the other thing that we are doing in the countries that we work is to provide technical support to governments in several countries to improve their monitoring systems, and encouraging countries to include baseline assessments on washing healthcare facilities into their national assessments, and integrating the GMP co-indicators for monitoring washing healthcare facilities into their health management information systems. UNICEF also continues to do work around evidence generation to provide evidence and knowledge for developing models for scaling up wash services in healthcare facilities with quality, and also promoting cost-effective approaches to scale up or wash services in healthcare facilities. And in countries like Bangladesh and Ghana, in 2018, they developed national strategies for wash in healthcare facilities to improve planning and budgeting for these facilities. And just like Tanzania, Bangladesh is one of the countries, for instance, that's part of the improving quality of care for maternal and newborn child health, which UNICEF supports. And I'm happy to learn that Tanzania is one of the countries that is implementing the wash fit, among many other countries that UNICEF, WHO, and partners are supporting to implement the wash fit. And we do all of this in collaboration with our health colleagues and other colleagues in the organization, but also outside of the organization. So a lot of collaborative work, which we support to ensure that wash in healthcare facilities is actually part and parcel of the work of the health sector. So moving forward, I just wanted to mention that one of the things we are planning to do this year is to develop an investment case for wash in healthcare facilities in collaboration with WHO. This investment case will help us to provide evidence for advocacy on washing healthcare facilities, but also provide initial estimates for financing needs and financing gap for washing healthcare facilities, and as well as provide evidence on the costs and benefits of different investment strategies that can be used to define a global roadmap for washing healthcare facilities. And like John mentioned earlier, in collaboration with Emory University this year, we will be rolling out a long distance training on washing healthcare facilities sometime before end of the year. So we will share those details with you as we progress. But yeah, and definitely running some webinars as well with Emory University and WHO. So thank you so much. I think those are some of the reflections I had on the presentation. Thank you.
Great. Thank you so much, Irene. Again, Irene Amongin from the UNICEF New York office. Thank you again for giving us even more information about what UNICEF is doing globally in Washington Healthcare Facility with WHO and other partners. So now I'd like to open up the floor for questions. We see that many, many questions have already been coming through the chat box, and we're really happy to see that. Again, please remember to select all attendees and panelists when you write your question, just so that everyone can see it. Also remember that we have a raise your hand function on the Zoom menu. So if you would like to actually speak your own question or comment, please raise your hand so that we can unmute you. So you cannot unmute yourself. So if you have a comment or question, please keep your hand raised until we call your name and we can allow you to speak. Remember, if we don't get to your question in the chat box or to your hand raised today, we will do our best to work with John, Frank, and Irene to respond to as many questions as possible that we will then post on our website after the webinar. So just, again, we have a number of questions and clarifications from the presentation, but I wanted to start off with a question for John regarding the presentation. We know that subnational action is crucial for the implementation of projects in Washington healthcare facilities. Could you talk a little bit more about the training of district and lower level facilitation teams that you mentioned and what their role would be in improving Washington healthcare facilities?
Thanks, John, for the question. I would like to invite my colleague Frank to talk on this question.
Hello, everybody, all participants. As we've heard, washing healthcare facilities saves lives. It saves lives of women, it saves lives of children. So we also know that it's at the subnational levels where the poorest hospitals are found. And what we saw in the presentation is that the smaller the hospital, the lower down the food chain, then the worse the services are. And it is also the clients of these hospitals tend to be the most deprived and the most marginalized. So we also are aware that the needs are enormous across Tanzania and in many countries similar to Tanzania. But we also know that there are quite simple steps that can be taken, that can be implemented with great results. And oftentimes you might ask yourself, well, if there are simple steps that can be taken, why is this not happening? A lot of the time is to do with lack of awareness. Also, it could be to do with lack of supplies, whether it is a running water supply, whether it is soap, whether it is hand washing, sanitizers, etc. So there's a whole range of supplies which need to be in place in terms of wash, which may not be in place. So for this reason, we believe that if you implement, some really basic behaviors and practices in healthcare facilities, then you can very quickly start to see small wins. And these small wins can drive calls for greater investment in infrastructure, where infrastructure is not at the level where it should be. These wins can also provide an evidence base, we feel, for what works, and can, if you like, begin to drive calls for support for Washington health care facilities. So, just for health, for well-being, but also for strategic advantage in terms of positioning Washington healthcare facilities at the center of policy dialogue. We feel that it's really important to start at the subnational level, grow momentum, and hopefully build up a groundswell of support that cannot be ignored, and that speaks for itself. And so what we're intending to do, we're just in the final stages of putting together a program where we'll be going to the districts that we support to train clinicians and ancillary staff on how to implement some of these programs. And it's really important that ancillary staff as well are included, because they are quite often the custodians of hygiene in these settings. And it's not just about practicing good hygiene, but it's also about ensuring that there are deep cleans of these hospitals that are done on a regular basis. I think if the two go hand in hand, then, as I said before, you're likely to see very quickly some small wins, which actually translate into lives being saved and morbidity being reduced. And that should then encourage government at all levels to make the investments that need to be made to improve Washington healthcare facilities overall. Over.
Great, thank you, Frank. We have a few clarification questions on the presentation for John. Regarding the assessment data that you showed, was the data the same as what's presented in JMP? Were these from rural versus urban facilities? And also, was it government versus non-government?
Okay, thank you, Joan. The data which I presented from two sources. One is the Service Provision Assessment Survey, which is a government-conducted survey, and it covers both urban and rural and both private and government hospitals. And then the other bit was the study that was conducted jointly between the National Institute for Medical Research and the UNICEF. And this was conducted in the 7 districts where UNICEF has some programs, but also it included both government and the private, and it covered most of the facilities in these 7 districts.
Okay, great. Thank you for that clarification, John. We have a hand raised from Maggie Montgomery from WHO. Maggie, can you hear us?
Yes.
I believe.
Can you hear me?
Yes, your voice is a bit low, but I think we can hear you. Go ahead.
Okay, let me try to raise my volume. So, first of all, thank you very much for the presentation and great to see so much progress in Tanzania. I have a 2-part question. The first is if you could talk a little bit more about the engagement of the health sector, both at the national level in terms of adopting the WASH guidelines into their own programs and thinking specifically, for example, around maternal child health, around universal health coverage, and potentially around outbreaks. And then the second question is, I posted some of the data that's on the JMP portal around waste segregation and around hand hygiene at points of care, both of which are quite low. And seemingly on paper, these are potentially low cost, but big win items. So just wanted to hear a little bit about the thinking of the incremental implementation of meeting these standards. And if they've looked at some of these simple measures, for example, putting a tank with a tap for in order to allow practitioners to wash their hands, or doing training on waste segregation to try to use make some good points. So I'll stop there. Thank you.
Thank you, Maggie. John and Frank, hopefully you were able to hear the questions that Maggie has posed.
No, it was breaking. Can you just repeat the question first? Just some highlight on the question. Yeah.
And Maggie, hopefully questions the way you posed it, but I believe the first one was with regard to the engagement of the health sector and how your initiatives have to operate. And then the other piece was regarding the incremental implementation of certain issues around waste segregation and hand hygiene, which appear to be quick wins that can relatively and you can get that up about these particular kinds of issues in terms of incremental movements. Hopefully,
Thank you, Joan, and thanks for the question. I will have this question, then my colleague Frank will go for the second one. So the engagement of the health sector, basically during the guideline development, most of the key partners or stakeholders were involved. Basically, this work was coordinated by the Minister of Health and particularly the environmental health section, but all the other departments within the ministry, like the health promotion, we are part of the process with facilitation from civil society organization, like WaterAid, UN agencies, WHO. So the engagement was quite high. Of course, there are still some issues around now, not only the guideline, but there are several issues. As you know, Tanzania has some sector-wide approach for health and for WASH. So there are still some gaps where these two subsectors, the planning is not harmonized. So these are the area which we need to address so that we all talk the same voice as we try to address the quality of care. Thank you. To Frank now.
Thank you. So in regarding the question about mental steps, right, there's small wins which can be had by implementing, as you say, hand hygiene, etc. A lot of this is not happening, but I think for this to happen, that these small wins are actually practical. And so part of the work that we've planned in our program is exactly to demonstrate this, that by investing very small amounts of money, it is possible to start to see more wins. But on a larger scale, a second thing that we are intending to do, last year we undertook a national school wash, which for the first time highlighted the gap in the national school. And so we want to replicate that this year and carry out a national washing healthcare facilities assessment. And just like we did for the school wash, that will allow us to then go ahead and prepare a costed plan so that we have a clear need about, a clear understanding, about the financing need, etc. And also prepare an investment case, which government can then use to attract funding to improve washing healthcare facilities. This political will is there, and not just political will, but I think also the government itself. Just 2 weeks ago, on a Saturday, the Ministry of Health called a meeting of all stakeholders in Dodoma, the capital, to discuss how quick, what steps could be put in place to begin to implement and to roll out the national guidelines. So there's political will and there's support for this, but as always, financing is a problem. And also getting people to prioritize it is not exactly big. So we feel that with this support, if we can show the way and provide the evidence, then there's every indication that we can begin to government steps to improve washing healthcare.
Great. Hopefully everyone was able to hear Frank. But again, thank you for your comments and response to the comments and questions from Maggie Montgomery. We're able to accommodate one more question, and we have one from Dr. Sodogar. And the question is, who can be the best person to monitor WASH compliance at health facilities? Is it the facility head, the staff nurse, or other managerial staff? If you have any thoughts about that.
Thank you, John, for the question. I think we believe that everybody at the facility has the responsibility for ensuring that WASH or quality services are delivered at the facility. Though the facility had as a bigger role, but I think both, even the frontline workers are the most important contact point. They need to be aware, and they are the one who can. Sometimes if you are occupying a managerial post, you are overwhelmed with a lot of responsibilities. So having someone who can monitor and report and track is very important. So, but we feel that I think it's the responsibility of everyone at the healthcare facility to ensure that WASH in healthcare facilities is adequately implemented.
If I could just add to that, the question of organizational change. So as John has rightly pointed out, it's not any one person, all of us. But to put that in place, I think there needs to be a program, a very carefully implemented program of organizational change that makes the case for why, for example, the use of hand sanitizers is across the board for everybody. And once this becomes second, then we begin to see rewards quickly. So it has to be a collaborative effort. Over.
Great. Thank you again to all of our presenters, Frank Mfungo and John Mfungo and Frank Odhiambo, as well as Irene, Amongin, all UNICEF colleagues working on Washington healthcare facilities. We've come to the end of our time together, so I'm going to pass it on to one of our colleagues to do our wrap-up notes. But again, please be reminded, if we did not get to your chat box question or your hand, we will definitely work with our presenters and commentator to respond to as many as we can and post it up on our website. So Cassandra, please take it away with our wrap-up.
Thank you again, everyone, for participating in this month's webinar. And thank you again to John Mfungo, Francis Odhiambo, and Irene Amongin for your wonderful presentation. We will leave the chat box open for a few more minutes, so please feel free to post any additional questions you may have. We encourage you to submit ideas for future webinar topics in the chat box or by emailing w&hcfaction@emory.edu. Today's recording, slides, and a summary document will be available within the next 2 weeks at w&hcfaction.org. These will include an overview of the session, any responses to unanswered chat box questions, and recommendations and actions for and resources shared by the panelists. We are looking forward to 2 webinars next month. On Tuesday, May 7th, we will have a 1 hour and 15-minute French session on the fundamentals of WASH and HCF. These will be similar to our sessions 1 and 2 presented, and they will be presented by Mahmoud Diallo of WaterAid and Mohammed Saad of Tourism. And on Tuesday, May 21st at 9 a.m., a regular English language webinar will focus on WASH technologies with presenters from PATH and Zero Mass Water. Thank you so much again for your participation today.
Thank you.
Thank you all. We'll keep it open for a few minutes, and we hope to see you again next month. Take care.